سوا على الهوا سوا على طول سوا على الهوا يأتيكم عبر أثير إذاعة
صباح الخير أمريكا
من يوم اللي اتكون يا وطن الموج كنا سوا.
Good morning and thank you for being with us. This is Khalil Hachem, editor of Michigan.com, the fastest growing digital business magazine in the Middle Eastern communities in Michigan. This show is brought to you in cooperation between Michigan.com and US Arab Radio. Weather is cold, temperature could reach in the mid-50s. We're looking forward to that little bit warm up. In the meantime, stay warm. Thank you for being with us. The number here is 248-557-3300. Please give us a call should you have a question or a comment. The biggest thing on everybody's mind today is the coronavirus. It is affecting our lives in every aspect. You know, whether we work, we stay home, we deal with the kids, and we're not really sure what the impact of this virus is. There's a lot of information out there, and there isn't enough information out there. It's very confusing. We're not really sure what's going to happen. And to be more accurate, it is COVID-19 or the new coronavirus. Most of us are trying to find out what the virus and how the virus will affect our lives, our livelihood now and in a few months. Right now, we're trying to survive this pandemic. It is a pandemic. It has been declared a pandemic. And then comes the elective worries, the other worries that we're not really thinking about right now, such as how does this virus affect us in the future, such as fertility, disruption of the lives of those who are trying to conceive, whether they're naturally or through in vitro fertilization. You know, how would it have, what kind of effect the virus would have, or this disruption would have on our reproductive system. And with us this morning is our good doctor, renowned fertility specialist, Dr. Shamma, to discuss the effects of the pandemic on, first to understand what the pandemic is, to understand what the virus is, and then what kind of effect it would have on fertility or reproduction. Good morning, Dr. Shamma.
Good morning to you. How are you?
Good.
I hope
How
all
are
our
you? I hope you and your family are safe.
doing well. Yeah, and I hope all our listeners remain safe and God willing, all is going to be fine come next year. But let's survive next year.
Absolutely.
Yeah.
Now we're focusing on survival. How does it affect you and your practice and your life, doctor?
Well, I mean, I think it's affecting me personally, and my family is the same. It's affecting every single person in the state of Michigan and the United States, and probably the rest of the Northern Hemisphere.
Sure.
It is clearly disrupting every part of our lives. I mean, it's disrupting work. It's disrupting the economy. It's disrupting the health of people that we know or people in the community and so on. So, I mean, it has unbelievable ramifications as far as there is disruption. And I think maybe as far as our discussion today, I don't know. I mean, should we maybe start by telling the listeners, I mean, what is coronavirus, or maybe start from the beginning and then we'll talk about that.
Yeah. Before we do that, Dr. Shamma, I just want to salute all of you in the medical profession, whether doctors, nurses, staff, because you right now you're on the front line of this battle, and you guys are doing an amazing job, tries to save lives, keep us safe, and protect us. I just want to take this moment to really salute you and thank you for taking the time out of your busy schedule to be with us and help everybody understand what's going on. And as you said, this is perfectly okay. Well, what first we're going to do is give an update. What is the coronavirus and what's a pandemic, so people will understand what's going on?
Yeah, I mean, the coronavirus or COVID-19 is a virus. I mean, it's really called COVID-19 because it's coronavirus disease of 2019. The abbreviation of it is COVID-19. And the virus that causes this is similar to previous viruses. There is a SARS coronavirus, SARS-CoV, and then there is a MERS coronavirus in the past, which is also a coronavirus, and this is SARS coronavirus 2, which is similar to the previous SARS coronavirus. And so the agent is a SARS coronavirus 2 that causes coronavirus disease of 2019, which is COVID 2019. So it is a virus that has never affected humans before. It has never been in humans until it originated in Wuhan, in the Hubei province of China. And that was in the beginning of the 2020. So, and it used to be present. We don't really know what the vector, which vector it came from. I mean, which other non-human primate that, or even non-primate that it was living in before it came to humans. But it was first present in the fish and meat market, livestock market in Wuhan in China. And then it spread to humans. And it naturally occurs in bats, in cats, in cattle, and even in camels. Coronaviruses do exist in those types of animals, maybe not that one, because we clearly do not know yet what virus is the culprit in this situation. I mean, what vector is the culprit in this situation in transmitting the virus to humans?
Do you know, doctor, what caused it to spin like that?
Well, I mean, we really don't know. I mean, it is to some degree, no one knows for sure, but eventually it will be found out. Remember, I mean, the Ebola virus, it took us years and years and years to find out what's the initial source or vector of that virus in Africa, to basically pinpoint it on a particular type of bats present in a particular cave in Africa before it spread to humans. And so in this particular virus, we're not exactly sure how it came, but we know it originated, and it first affected that fish and live meat market and live animal market in China, and then it spread to humans. So it's really not clear how it happened, but it really did happen because of the proximity of and too many humans maybe in that market, and maybe they handle those animals in a particular way over there. It's not really clear.
Is it unusual for this to happen? That goes from animals to humans.
It is unusual in the sense that it has never happened before, like in the last many years, as far as this virus is concerned. But other viruses do hop from animals to humans. Yeah, sure, from birds to humans. Remember, I mean, there was other virus. There was the swine flu. Why did we call it the swine flu? Because it affected swine. I mean, it affected pigs. Mm-hmm. And this one probably affects some other animal of some sort in Wuhan, and then that's how it made it to humans.
Yeah. Now, the flu virus itself mutates every year. Is that correct?
Most viruses mutate. Now, remember, I mean, people might not understand what viruses are. They're actually barely living organisms. They cannot live on their own. I mean, they cannot reproduce on their own. If you put a virus next to another virus, it doesn't mate and become a third virus, or doesn't split to become a third virus. The only way virus replicates is by infecting some other host, whether as some other animal, and in that animal it commandeers the DNA machinery of that virus, of that animal, and then it uses it to make more copies of itself, and in the process it destroys the cell that it infects. That's how all viruses do. So in essence, they're barely living organisms that cannot live on their own for any extended period of time and need a host to replicate and spread themselves.
Do we know by now how long this virus lives on surfaces, different surfaces?
Yeah, I mean, this is actually a good question. We don't know for sure, but we know that it lives for several hours, sometimes on particular surfaces, on plastic and on wood and so on. And that's why, when we talk about prevention and so on, not touching other things and not touching our faces and washing our hands all become like crucial parts of the paradigm that is needed to control that virus, so that virus spreads. So, they do live for several hours at least.
And how does it come out of the person? Is it through coughing, through touching?
Yeah, I mean,
Or,
different viruses affect humans in different ways. I mean, some of them affect it through the oral fecal route, so basically that way, and others like this one virus and like the influenza virus are aerosolized viruses. So we actually cough them or sneeze them out, and when we do that, they infect another person if that person is within a distance of 6 feet or 2 meters away from us. They fall on their hands or their face, or their clothes or anywhere. And if they fall on them, and then that person touches his or her mouth or nose, or maybe her eyes, we don't know yet, it gets into our bodies, and then it infects us. But it's basically aerosolized, and that's why.
I'm sorry. What was the last? What was the last thing?
And that's why they're aerosolized. They're actually spread through airborne transmission. Now, that is why I hope, and this is just a wishful, educated guess, is that when the weather improves and we have more sunshine, maybe not as much in Michigan, but hopefully hotness, and more ultraviolet radiation comes in, it will actually even allow the destruction of the virus. And that's why usually, let's say, influenza epidemics ebb during they become worse during the winter months, and then when the sun comes out and we have summer and spring and summer and early fall, then it disappears, and then it comes back in the next season.
Absolutely. Now, you can't really kill a virus in the body. Is that correct? You can't really create some kind of a medicine where it can kill the virus.
No, I mean, there are ways to there are some other viruses that we've devised mechanisms to actually prevent the virus from replicating. Remember, a very notorious virus that caused havoc in humans and all over the world is the HIV virus. The HIV virus is now a controllable virus to some degree, because it's a lifelong treatment, but it involves retroviral therapies that prevent the replication of the virus. And there are several mechanisms to prevent viral attack as far as medicines are concerned. You can actually prevent the virus from coming into the cells by blocking the receptor that the virus uses to enter the cell. Once it enters the cell, you can actually come up with mechanisms to prevent the virus to replicate within the cell. So there are so many different levels of attack to the virus, and naturally, we humans, in some viruses, not in all viruses, clearly not the HIV virus, for instance, can develop antibodies to the virus. And that's how vaccines work, where you actually kill the virus and doesn't allow it to enter into its host cell, whatever that host cell is. This virus, particularly, for instance, the coronavirus that we're talking about now, the COVID-2 virus, affects alveolar cells because it affects a particular receptor called the ACE2 receptor within the lungs. Yeah. So in theory, if you had a medicine to knock down that receptor, which we can't because we'll all potentially die from hypertension, that receptor is used to control blood pressure, we could have, in essence, prevented the virus from entering the alveolar cells and causing havoc. But we don't yet, or will have.
What we're going to do, Doctor, is we're going to take a short break, and we'll be right back to stay tuned.
Sure.
مراكز IVF ميشيغان للخصوبة وأطفال الأنابيب الرواد في مجال الطب التناسلي تعلن عن استقبال مراجعيها في بلومفيلد هيلز ومراكزها المنتشرة في ميشيغان وأوهايو، حيث يتواجد أمهر الأخصائيين لتقديم الاستشارات في جميع مجالات التلقيح الصناعي. يعتبر الدكتور نيكولاس شاما أحد أهم الأخصائيين في الغدد الصماء التناسلية في ولايتي ميشيغان وأوهايو، حيث أجرى أكثر من 10,000 عملية طفل أنبوب وساعد الآلاف من الأزواج على تحقيق حلم الأبوة. يحمل الدكتور شاما شهادة البورد الأمريكي في كل من أمراض النساء والتوليد، أمراض الغدد الصماء التناسلية والعقم، رعاية طبية ممتازة وتفهم عميق للأثر العاطفي والنفسي لحالة العقم. للاستفسار اتصلوا على 248-952-9600 248-952-9600. سوا على الهواء،
سوا عطول
سوا على الهواء، يأتيكم عبر أثير إذاعة
صباح الخير أمريكا.
من يوم اللي اتكون يا وطن الموج كنا سوا.
Welcome back and thank you for being with us. We're discussing the coronavirus with Dr. Nicholas Shamma. And if you have a question, please give us a call. The number here is 248-557-3300. We'll welcome your comment or if you have any questions to Dr. Shamma. Doctor, this virus doesn't seem to be as lethal. So why are we so scared of it?
Oh my God, this virus, Khalil, I disagree with. This is one of the worst aerosolized viruses that have existed as far as us humans are concerned, because it is highly infectious. Compared, let's say, to the usual influenza virus, is at least 3 to 4 times more infectious, in a sense that each person usually infects 3 to 4 other people, whereas with the usual influenza virus, it infects one person. Each person infects one other person. And more importantly, as compared, let's say, to the regular influenza virus that affects us every single season, influenza usually kills only somewhere around 0.1%. So 1 in 1,000, humans. This, unfortunately, affects and kills somewhere around 2 to 4, maybe 3% of humans. So we're talking 30 orders of magnitude. So if you multiply those two factors together, the 30 times more lethality or mortality rate and the 3 to 4 times infectivity rate, you're talking about a virus that is, at least 100 times more lethal than influenza.
And who's more at risk?
This is actually a very good question. It unfortunately affects more subgroups of people than other subgroups, but then maybe it's a good thing and it's a bad thing at the same time. It affects people that are more frail than other people. And that actually is why maybe the mortality is different than other viruses. So it affects the older people, and when it affects the older people, especially those with comorbidities, we're talking about diabetes, hypertension, chronic lung disease. It causes more havoc in those individuals, regardless of the age group, but especially if they're older. And the mortality rate, we're talking about if somebody gets infected and you're above the age of 80, we're talking about 15% mortality. That is huge. And if you're, let's say, in your 70s, we're talking about somewhere around 4%. And if you're in the 60s, we're talking about 8% if you're in the 70s, and somewhere around 3 to 4% if you're in your 60s. And less so if you're younger than 60 years of age. Now, but people have to remember that even younger people are affected by the virus. So there was, and we can talk about, testing and whatnot. When South Korea tested people, they tested a lot of people, not just people showing symptoms. Whereas in Italy, they mainly tested people that showed symptoms because they didn't have the testing mechanisms to do that. And the younger group was affected to a substantially higher degree in the asymptomatic country, in the asymptomatic population. So we're talking about 20, 30% of the people tested positive if you do mass testing. And when they did mass testing in South Korea, compared to a substantially lower number in when they did it in Italy, suggesting that the younger people are getting infected, spreading the disease, but they're not getting sick from it. And that's what the social distancing part of the treatment plan that has been put into effect, at least I hope it's being put in effect in everywhere in the US, hopefully plays a role. And the main people that are spreading the virus are the younger people. But the main people that are dying are the older people that have comorbidities.
Now, explain to us, doctor, when somebody gets infected, how long does the virus incubate in the body, and then what happens?
Okay, usually incubation period for this particular virus is somewhere between 2 to 14 days. And then the symptoms of the virus mainly are fever first. They have, they feel hot, and the fever is usually in excess of 38 degrees Celsius. So we're talking somewhere in the people using the Fahrenheit scale, somewhere around 99 to 100 above it. And when you have that, you develop somewhere around 75% of the time there's a dry cough, and less so you have sore throat. And if people are going to develop pulmonary, and that's the serious part of the problem, pulmonary issues, that happens usually within 8 days after they develop those initial symptoms. And that's when it affects the lungs, and they have difficulty breathing and difficulty and substantial, concerns related to other medical complications that happen because of the difficulty breathing. So somewhere around half of the patients that develop the viruses that are symptomatic will develop pneumonia, and the pneumonia that happens in 1/3 of the time, when it happens, it leads to very critical and serious medical conditions, and that's the problem. Because usually most of those complications happen because of the pneumonia and the respiratory distress, and therefore multi-organ failure, and eventually horrible things, God forbid, happen to people.
Sure. I mean, the regular flu, some people get it and they stay home and they nurse themselves, and eventually they're okay.
Well, I mean, even the same thing with this one. The same thing with this one, Khalil. If you think you have coronavirus and you're young, and the first thing you should do is, you should call your doctor, and you call your whoever you want to call, basically from the medical field. And if you think you have corona, you have that sore throat, you have a fever, and you're having difficulty a little bit breathing, then you don't rush in and go to the hospital right away. You have to isolate yourself from your family first, so that you don't spread it to them, and they have to isolate themselves from the rest of the world so they don't spread it to the rest of the world. And remember, we're going into the spring season, so there's a lot of allergies. Not everybody that has a stuffy nose has coronavirus.
Exactly.
And not everybody that has a runny nose has the coronavirus. And not everybody. So we're talking about symptoms related to fever, related to malaise, to cough, and especially difficulty breathing. There is a very easy test that people could do, and that actually would point them in the direction that maybe they might harbor coronavirus or SARS coronavirus 2, which is basically if they can hold their breath in the morning for 10 seconds without having significant issues related to be able to breathe, then they probably don't have coronavirus, or they don't have the pulmonary part of the coronavirus. And that's sort of an easy screening test that people can do every morning at home. When I wake up in the morning and I wash my face and everything, then I just go ahead and do the test, or just immediately when I wake up? No, you can actually, this is a screening tool. It's not like a panacea in terms of testing.
Sure.
So, you could do it any time in the morning, but do it in an area that is clean. Don't go to the garage
Sure.
and turn your car on,
Sure.
and then try to...
No. Yeah, absolutely.
I'm joking with you. I'm joking.
Yeah, absolutely. This is really, absolutely. And then if somebody really can't hold their breath for 10 seconds, well, then they should, along with cough and other symptoms, and then they should consult their doctor.
Yes, and don't show up at your doctor's office without calling, because a lot of doctors' offices are not prepared to deal with corona or any other highly infectious agent. Because, I mean, remember, you're going to show up to a waiting room, infect everybody in the waiting room if you're sick, infect the front desk people, infect the doctor and his staff if you just show up like this. So there are certain clinics and physicians' offices that are prepared for this. And if your doctor might tell you just show up in the emergency room, and even in the emergency room, do not show up and infect everyone in the ER. Call the hospital or the emergency room and tell them you might have corona and you need to be tested, and they'll tell you what to do, where to go, and how to present yourself, and so on, because of the concerns related to spreading to other people. And that's why this disease, actually, as opposed to other diseases, is a disease that we all Americans have to deal with it as a community, as one body, as all of us are in it together. And the only way to mitigate the disease now that it's present here is to prevent its spread. And there are so many mechanisms. Most importantly, it is social distancing. And I wish, there was a complete lockdown for 2 to 3 weeks, and that certainly would allow the virus to some degree stay dormant and not spread, and allow flattening of the curve, like everybody is talking about, I'm sure in the media and so on, and therefore it can be dealt with.
It sounds like we really didn't do a good job from the beginning. This has been around since November. We didn't really do a good job in this country of keeping people, or educating people, or jumping on it right away to make sure that it doesn't spread.
Well, remember, humans, think about Europe, think about China, think about South Korea. Remember, you're talking about an infectious agent, and in the age of global exchange and global trade and so on. Humans and goods and services are hop from one part of the globe to the other within hours. So, I remember at the end of January when President Trump decided South China, everybody called him a xenophobe. And he did the right thing. He basically bought us in the U.S. at least a month to be able to deal with it. In Italy, they didn't do that. All the Chinese tourists continued to go to northern Italy, and that's how Italy had this massive surge in infection, because they were ill-prepared and didn't stop the travel plans of the Chinese to northern Italy, to Milan and so on.
Yeah,
and that's how it spread to Europe. That's how literally the virus spread to Europe, and that's how it's spreading to the United States. So clearly, the source of the virus is Wuhan, China.
Absolutely. Well, we're going to take a short break, and we'll be right back. Please stay tuned.
Sure.
When it comes to reproductive medicine, IVF Michigan Fertility Centers are the recognized leaders. With locations in Bloomfield Hills and 5 other cities in Michigan and Ohio, IVF has experts in all aspects of the field. As a founding member of IVF Michigan Fertility Centers, Dr. Nicholas Shamma is one of the leading reproductive endocrinologists in Michigan and Ohio. Dr. Shamma has performed over 10,000 IVF cases and has helped thousands of couples fulfill their dreams of parenthood. American board certified in both obstetrics and gynecology and reproductive endocrinology and infertility, Dr. Nicholas Shamma is a very caring, compassionate, expert physician that understands not only the medical but also the emotional toil of infertility on his patients. When it's time, get personalized care from Dr. Nicholas Shamma at IVF Michigan Fertility Centers in Michigan and Ohio. Call toll-free 855-952-9600, 855-952-9600.
سوا على الهواء
سوا عطول
سوا على الهواء يأتيكم عبر أثير إذاعة
صباح الخير أمريكا.
من يوم اللي اتكون يا وطني الموج كنا سوا.
Welcome back and thank you for being with us. This is Khalil Hachem, editor of IVF We're talking to Dr. Shamma about the coronavirus, and we're gonna, in this part of the show, we're gonna get into, how do we protect ourselves and how do we reinforce our immune system. Also, how does it affect fertility? This is a subject that, although it's not an emergency right now, but it's important, and it could be an emergency for people who are wanting to have children right now. The number here is 248-557-3300. If you have any questions or comments, please give us a call. We'd be more than happy to talk to you. Dr. Shamma, how are we doing here in the U.S.? Are we doing the right thing? Are there more testing needed? How do we measure?
No, I mean, we are certainly doing something, but I mean, I'm from the group of health professionals that I was hoping that we could do more on the front end in terms of testing and in terms of quarantining and in terms of mitigating even the entry of the virus into the country. But that's at this point in time, to some degree, that is too late. I mean,
Sure.
And if people were not ready for it. This is the problem: is that you could have locked down the United States early on, not just from China, also from Italy, also from Europe, also from areas that might have had the virus spread to them, and dramatically decrease the inflow of the virus to the United States. And there are certain countries that have actually imposed sort of draconian measures to prevent the inflow of people. And if you prevent the inflow of people that are carrying the virus, you actually stop the spread of the virus to your population. But number one, the testing was faulty, and the CDC was not, Center of Disease Control, was not prepared for this epidemic, and they were prepared for sort of smaller epidemics, not a pandemic. And by the way, we never defined pandemic. Pandemic is a disease where there's local transmission everywhere on the globe. So they were not prepared.
This is what we have right now. Is that correct?
No, the testing actually is improving right now considerably.
Yeah.
But the testing that we did initially was A, not available, B, not a good test. And even if you want to do the test, it's not easy to do this particular test. You have to wear protective, what we call PPEs, personal protective equipment. Every time you do the test, you have to change your PPEs so that you don't infect the person that's doing the test the second time around, and he doesn't have the virus. Because it's not everybody that's being tested will have the virus. Say that again, Khalil.
What's PPEs? You said change your PPEs.
It's a personal protective equipment. So people have to be, the people doing the test for you have to protect themselves. Otherwise, they're going to get infected.
Absolutely.
Especially that when you do the test, there is because you do it both, nasopharyngeal, and there is a very good chance when they do the test for you, you're going to cough. So if you cough on that other person is not, or he or she not wearing protective gear, they get infected.
Exactly.
So the testing is not easy. The tests themselves were flawed, and that's basically one of the concerns that allowed the virus to spread more. But clearly, the lack of restrictions to travel was and people were not aware of the gravity. I can tell you from, let's say, my office. I had people in my office that were saying, "Oh, we're still," as of actually literally last week, middle of last week, not the end of last week. We're saying, "Okay, we have a cruise set up, or we have a flight that we're going to go to." And somebody was telling me they had a wedding in Mexico, and somebody else was telling me they're going to Florida for spring break. And I was telling them, "What the heck?" I mean, they were not. People were not ready. They've never seen this before. They were not realistic in their expectations, and they didn't realize the gravity of the situation from the beginning.
Yeah.
And here's the problem with what I'm sort of would have advocated is that it would have shut down the economy. And you've seen what's happening to the market and so on in terms of the economy.
Yeah.
I mean, people are losing their jobs. people are stores are closing. But then, if you did that like they did in Wuhan, you can actually stop the virus in its tracks, and that's why it didn't spread to the rest of China.
Yeah.
And now it's spread to the rest of the world. Because we are an open society, we cannot enforce draconian measures like they did in China. But they were able to, in a free economy like in South Korea, they were able to do it. They were able to do it because people realized the gravity. And I mean, just to give you an idea, most of the disease spread in South Korea happened from one person that they identified the first 30 people. Patient number 31 went to church, went to one place, went to another church, went to a hospital, and that patient 31 was able to spread the virus. The first 30 were able to be quarantined and didn't really spread it to anyone. So it just took one person to cause the epidemic in South Korea. And what about here in the United States? People are getting it and not know that they have it. And there's, especially the younger people, are still going to bars until yesterday, to restaurants, to going on spring break. I mean, this is insane in my opinion, but that's what's happening.
I know. We have a caller. Jerry is on the line. Good morning, Jerry, and very quickly because we don't have a lot of time.
Thank you, Mr. Khalil, for taking my call. Good morning to you. Good morning, Dr. Nikolai. This is Jerry Habba. How are you, sir?
Hi, Jerry. How are you?
Good,
just stay safe.
Go ahead, Jerry.
Dr. Nikolai, thank you for all this information, but I have 3 points to make, Dr. Nikolai.
Do you have a question, Jerry?
Pardon me?
You have a question?
Yes, sir. 3 points I want to address.
Okay, go ahead with the question. Go ahead with the question, please.
My first question, Dr. Nikolai, when you walk to any facility, there is central air. If it is air conditioned or heating, don't you think we should stop this central air because that could separate the virus in any place where there is a public over there? Second point, doctor, don't you think will be necessary to change the clothes or uniform when you come from work, home, or the opposite? Number 3, just like you carry driver license in your wallet, don't you think every individual should carry a small sample of sanitizer in their pocket and to use it when they go back and forth to work, to restaurant, to home? I would love your answer.
Thank you, Jerry.
Thank you very much.
Thank you.
Jerry, they're very good. I mean, thank you for your call. These are very good measures. These centralized air processing systems are, of course, important, and not all offices have HEPA filters and so on that actually will take care of infectious agents. Some of us, let's say, in our particular offices have that because of what we do for a living. And we haven't addressed pregnancy and so on, and I wish we can address pregnancy and fertility in a little bit.
We will.
All the measures that he advocated are important. I mean, he talked about going and coming to work and so on. I mean, he should try to work from home if he can. If he has a services office, he should just not have the office open. Clearly, that has a major economic impact. He clearly needs to wash his hands several times a day with soap and water and hot water for at least 20 seconds. He needs to use the sanitizers that have 60% alcohol in it. He needs to change his clothes. He needs to change his shoes even. I mean, he should keep his shoes outside his house, his actual dwelling. All of this sheltering, social distancing needs to be done. Yesterday, President Trump and the task force advocated that no more than 10 people ought to be together ever in this day and age until the virus pandemic dissipates. So, and restaurants and bars and public places where people aggregate should not be aggregating in. I mean, I don't know how voting is going to happen or airports where people queue up next to one another ought to continue existing with the concerns of the virus. So all of those things need to be enforced, need to be done. I mean, tried. And the best thing to do is the following: for people that are older, that have pre-existing conditions, they need to stay home, Khalil. They need to go nowhere, and just hopefully they have enough food to survive. but they need to stay put in their homes until this virus runs through the climate gets rid of it. Until we get into next season, and God willing, by next season we'll have a vaccine or some treatment that has been proven to be efficacious. So until then, they need to stay at home. This extreme social distancing needs to happen to older people and those with pre-existing conditions. And we're not just talking older people pre-existing. Somebody who's diabetic, somebody who's immunocompromised, somebody who has had a cancer treatment. All of those groups of people, even if they're young, they're at major risk. Now, that actually, to some degree, involves pregnancy. So I want to just mention something. We do not know the effect of the virus on pregnancy. We know few things. There are a few reports from China that involve very small groups of people that actually were to some degree reassuring in the sense that it does not seem that this virus, the SARS-CoV-2, does cross the placenta to affect the baby. So if you're pregnant, it doesn't seem to cross to the baby and affect the baby. Number one. Number two, it doesn't. All the babies that have been born from moms who had COVID-19 infection in China seem to be free of the virus. So what we do not know is the effect of the virus in the first trimester of pregnancy, because there is no data, neither from China nor from anywhere else in the world. But if we want to extrapolate if it doesn't cross the placenta, then it doesn't seem to be able to affect the baby in any substantial form. But that's to be determined yet, because this is a brand new virus. We've never seen it before. We don't really know exactly what it does. So for pregnant women, they need, because they could be to some degree immunocompromised in pregnancy compared to other non-pregnant women, they should do extreme caution and extreme social distancing, like we're advocating for the older people with pre-existing conditions. And then comes the issue of what happens to somebody who has COVID-19 that delivers a child. That becomes a much more complicated story.
Absolutely. Now, and it is still a new virus. We really don't know what's going on with fertility either.
Well, I mean, the fertility doesn't seem to be affected by the virus. I mean, clearly the virus is an aerosolized virus. Now, in terms of fertility is concerned, we don't think that. I mean, actually, this is we don't think it affects the chance of getting pregnant, because it doesn't really affect any fertility organs. Let's put it that way. But clearly, if somebody, I mean, remember, to have a baby, you need to have you need to have some intimacy with your partner. So again, the idea of social distancing cannot be imposed to any significant degree within the household. I mean, it is impossible unless somebody gets COVID-19, then you isolate him to one room and bring food to him or her in that room. But most people living together are still intimate, are still in close proximity to one another, and therefore, I can tell you something funny. The expectations these days is, because everybody is not staying at home and not going anywhere, is that there'll be a baby boom within 9 months from now.
I didn't know if you recall that
there would be the reverse. I mean, it's a reverse fertility, a mini baby boom in 2021.
Yeah. I don't remember what year. I remember reporting on it for the Arbor News. There was a storm, and everybody stayed home for like 2-3 days, and 9 months later there was a boom in babies. So this could provide more.
Khalil, us humans, we're social beings. We cannot exist in our homes, and that actually raises the question that we should address: is this disease causes a lot of stress? Because number one, there's a lot of fear, and it is actually calculated fear. Truly, I mean, we're fearful of getting infected and infecting others and so on. But remember, we are people like myself, have businesses to take care of, have employees, have families, have wives, have one wife, have kids, and so on. No, I'm just talking in the abstract. But I mean, all of those other people are affected by your behavior, and myself included. I mean, am I stressed? Yes, I'm stressed, but I hope I don't develop a secondary stress disorder. But then my other people around me are split into two groups. Some group is in denial. These are the younger group. My kids, for instance, my teenage kids are in denial. My older kids are completely not in denial and they're scared. And you have to be able to tailor your behavior to different groups or subgroups of people to address those issues. I mean, my 15 and 14-year-olds, they don't have school because thank God we stopped all classrooms and schooling in the U.S. They think it's a vacation at home, spending it on Fortnite or some other thing. You know what I'm saying? So it's just it's very difficult to tell someone who is healthy and is fearful of some abstract disease outside that they need to feel with other people, especially if they're a teenager. And more importantly, if you let those teenagers loose, playing outside, going visiting their friends, having their friends come and visit, then you actually basically do something that is not advocated, and that makes the virus spread within those populations that don't get sick, but infect the other people that are more likely to get not just sick, but critically sick from this.
Before we talk about how we can reinforce our immune system, we're going to take a short break. We'll be right back. Please stay tuned.
مراكز IVF ميشيغان للخصوبة وأطفال الأنابيب الرواد في مجال الطب التناسلي تعلن عن استقبال مراجعيها في بلومفيلد هيلز ومراكزها المنتشرة في ميشيغان وأوهايو، حيث يتواجد أمهر الأخصائيين لتقديم الاستشارات في جميع مجالات التلقيح الصناعي. يعتبر الدكتور نيكولاس شاما أحد أهم الأخصائيين في الغدد الصماء التناسلية في ولايتي ميشيغان وأوهايو، حيث أجرى أكثر من 10,000 عملية طفل أنبوب وساعد الآلاف من الأزواج على تحقيق حلم الأبوة. يحمل الدكتور شاما شهادة البورد الأمريكي في كل من أمراض النساء والتوليد، أمراض الغدد الصماء التناسلية والعقم، رعاية طبية ممتازة وتفهم عميق للأثر العاطفي والنفسي لحالة العقم. للاستفسار اتصلوا على 248-952-9600 248-952-9600. سوا على الهواء،
سوا عطول،
سوا على الهواء، يأتيكم عبر أثير إذاعة
صباح الخير. صباح الخير أمريكا.
من يوم اللي اتكون يا وطن الموج كنا سوا.
Welcome back and thank you for being with us. This is Khalil Hachem, editor of Michigan.com. We're talking with Dr. Shamma about the coronavirus, its effect on the body. Dr. Shamma, we've been talking about how it affects pregnant women and we don't have any evidence on fertility. How about people who are want to get pregnant but like doing in vitro? Is that something they should consider? What should they do?
Well, here's the thing. I mean, we have people that are doing in vitro right now. I mean, I'm going to my office right now to do in vitro, basically, and to see patients that have fertility issues. Remember, there is a problem in biology that has nothing to do with the virus, which is reproductive aging. Reproductive aging affects all people, and at some point they run out of eggs, and therefore time for them is the essence. So for us to tell them, okay, you just need to postpone things for 6 months, then it might not be possible. So for people that can postpone, doing in vitro, then they are postponing. But there are some people cannot postpone in vitro, and therefore they literally have to do it. So we are still open, but we are taking extreme measures to maintain the safety of all our patients, and also extreme measures in preventing us from getting sick, and to some degree advocating that all patients that are sick or have cough or have sore throat or have a fever not show up in the office to do whatever needs to be done, because then they could be having coronavirus, but most likely they don't have coronavirus. I mean, not everybody that has a fever, that is sick or whatever, has a runny nose, as we said before, has coronavirus. But to some degree, we're
Exactly.
taking extreme measures to mitigate the transmission, and we're advocating the social distancing, the cleaning, the washing, the disinfectants, and so on. And that's basically what we're doing. So in essence, because of what we do sometimes is to some degree urgent and not elective, we are still doing it. But if people can postpone, then maybe they should postpone if they don't want to. If they want to stay at home for the whatever duration of 2 to 3 weeks,
Yeah.
or months.
Now, what can we do to make sure our immune system stays strong?
Well, it's to remain healthy. What we need to do, Khalil, is to remain as healthy as possible. For instance, don't start smoking now. For instance, that's really bad for pulmonary diseases.
Yeah.
If you're a smoker, maybe you should strongly now consider not smoking, because I guess your lungs are not as good as other people. And remember, a lot of the data from China is coming from people that are chronic smokers, because most of the Chinese are chronic smokers, and it was very difficult to. So are the Europeans. Now, here in the U.S., only 25% of the population are chronic smokers. So, I would advocate that they do not smoke, that they should still engage in activities that promote our well-being. For instance, they should exercise, they should eat healthy, they should do all that stuff. Now, you might say, well, how could they exercise if they're still sitting in their homes in confines of an apartment? Then they could maybe walk outside. If you walk outside and do not touch anything, and you do extreme measures like in a park by yourself, then you're not exposing anyone or being exposed to anything. So, all of those measures ought to be done to remain healthy. Also, mental health is very important in terms of our immune system. You need to still engage with your loved ones, maybe granted, not through seeing them, but through our electronics. The more you talk to them on the phone, the more you talk to them, using social media, whatever method you want, the more you're actually still in touch with the people that you love and care for. So all of those measures ought to be done and are important. And believe it or not, it helps our immune system. There is no drug to give to boost immune systems. There are vitamins and people do stuff like that, but none of them have been ever shown to literally boost the immune system to any significant degree.
Is there
if you
anything,
eat
Doctor, I
healthy
haven't
and
asked
remain
you?
healthy.
Absolutely.
Well,
Absolutely. Is there anything?
Yes. What you didn't ask me is what should people. We talked about social distancing. I cannot underscore the importance of this fact. People need to maintain a distance of at least 6 feet from any other person in this day and age, number one. Number two, they need to wash their hands many, many times a day with soap and water for at least 2 minutes. And if they don't have that, then they should use a hand sanitizer that has at least 60 to 70% alcohol in it. They also should, believe it or not, drink a lot of warm water every 15 minutes or so, because once you wash the virus, if the virus happens to get into your mouth and you actually swallow it, you kill it in your stomach. So staying hydrated and keeping your mouth moist and washing whatever comes into your mouth into your stomach every 15 minutes or so strongly mitigates against the virus going into your sinuses and throat and whatnot. And disinfect everything around you. We have people in my home and in my office going around with disinfectant, whether it's Lysol, whether it's bleach, whether it's whatever, disinfecting areas that other people touch, and also doorknobs and handles and light switches and whatnot, all the time to again mitigate against having the virus spreading through inanimate objects, not humans. And finally, most importantly, if you can work from home, do so. If you can avoid going anywhere except getting food, do so. Yes, that's going to screw up the economy, but it's better to stay safe than the economy surviving, sort of.
Absolutely.
Because at some point, if we all get sick at the same time, we do not have the resources, medical resources, in terms of personnel, in terms of people, doctors, nurses, technicians, whatever, to take care of the sick. And two is we do not have enough intensive care measures and intensive care equipment to take care of the critically ill. That will basically overwhelm the medical system in place.
Absolutely.
So that is why we need to flatten the curve, not having a massive inflow of people in this situation.
Absolutely. But Dr. Shamma, I want to thank you so much for taking the time to be with us. This has been a great information. I want to wish you good health and safety to you, your family, and your patients, and your staff. You have a wonderful, wonderful staff. When I visited the office last time, and I just can't thank you enough for taking the time to be with us.
You're welcome. And you stay safe, Khalil, and may God make this go away as quickly as possible, and for all our listeners to remain healthy and safe, and God willing, this will just pass.
Thank you so much. We appreciate it.
Bye.
Okay. Thank you, everyone, for being with us. We really appreciate your time with us. And also, don't just assume things. Talk to people who know. There's a lot of information online. Some of it is good, some of it is bad. Be careful what you read and be careful what you listen to. Make sure your source of information is accurate. Thank you so much for being with us. Thank you, Mike, for great production. We'll talk to you soon. Bye now.